second chapter is about how the blood flow in the lungs is and how it comes or how is it related to the gases in the lung. So you have the lung as a junction or a station where two trains come together. One train, the blood, which has arrived here to get oxygenated, offload its carbon dioxide. The second train is the air that you bring in, okay, for fresh oxygenation and taking away the unloaded carbon dioxide. So both of these trains they arrive at in the lungs all the time. The bogies they interchange or intersect in the lungs all the time. How is this arranged? Is the topic, is the focus of chapter number 2 of respiratory physiology in Guyton. How do these two flows, blood flow, air flow, or ventilation, how is it arranged, physically arranged? We need to understand certain peculiarities of the vessels of the lung. We call it pulmonary vasculature or pulmonary circulation. Pulmonary circulation has a few peculiarities, i.e., it's different from the systemic circulation in two, three very important ways. Okay. An examiner can ask you about these differences in a go. So in a Viva, usually we are looking for summaries, not long, long explanations. So you may know the explanation, the long one of say one or two, but in a Viva, usually we are after lists. List the three differences between pulmonary and systemic circulation. Okay. So one big one, just to give you a flavor of what we are talking about, is whenever there is hypoxia in systemic circulation. What is systemic circulation? Systemic circulation is every circulation other than lung. So the entire body is on one side, it's called systemic circulation, and the lung is on one side, it's called the pulmonary circulation. Okay. Why is this discrimination with the lung? Well, because the right side of the heart pumps its entire output into one organ, the lung, and the left, it pumps its entire output into the rest of the entire body. So that basically differentiates between these two circulations. From this, immediately the perceptive student would feel that so both of the cardiac outputs being equal, and they are equal. You are studying heart, right? Okay. You will study cardiac output. You will study what is a cardiac output and how both of the ventricles have the same cardiac output because they are linked in parallel or series. They are in series. So the right one needs to work for the left one to work. If the right stops, eventually the left will stop because where is the blood coming in the left from? From the lungs. Where is the blood in the lungs coming from? From the right. So it's like this, right, then left, right, then left. So whatever right does with the lung, lung does with the left side of the heart. Okay, this is how they're connected. So check this out. If the left ventricle pumps 5 liters per minute in the entire body, and that's what it is that the right needs to provide that 5 liters through the lungs to the left ventricle. That's a very straightforward equation. But imagine those 5 liters need to be per minute accommodated in one organ, as compared to for the left. For the left, the field is very wide, the whole body. But for the right, the field is only the lungs. So immediately you should arrive at one conclusion that the compliance, and now you should know what the word compliance means. I will not explain. The compliance of the vascular, of the vessels of the lung is much, much higher, has to be, as compared to its systemic circulation cousins. And it is the case. It's a very compliant tree. The pulmonary vasculature is a very highly compliant tree. It distends per unit pressure a lot because it needs to accommodate the entire cardiac output of the right side. Okay. So that is one peculiarity. There is one difference between these two. So pulmonary artery is thinner, larger in diameter, highly distensible. Basically, overall, it's very, very compliant because it needs to accommodate a lot of blood all the time. Pulmonary veins are nearly the same as systemic veins. This is difference number one. These are pressures. Just look at these pressures when you will reach this information for the left side in the heart physiology lectures, you'll appreciate there's these pressures. So look at pulmonary artery, systolic pressure 25, diastolic 8. Okay, as compared to systemic circulation, where the systolic pressure is 120 and the diastolic is 80. So from that point of view, look at these pressures. They are very low pressures. So the rest is you just need to learn it. The main pressures are these. In that, the main pressures are these actually. The systemic 25 by 8. This you need to remember. And the mean of this is 15. So at all the time, there is a gradient between the pulmonary artery side and pulmonary vein side. That gradient of pressure is 15 mmHg, average. So from the arterial part of the lung to its venous part, the downward slope, the pressure which is pushing the blood through the entire lung across from arteries to veins is 15 mmHg. This is the context of this 15 mmHg. So inside the lung, there are actually two circulations. One is pulmonary, which we are repeatedly mentioning. A very important mention of bronchial circulation. Bronchial circulation, very simply put, is the blood supply of the lung itself. It's a living tissue. It needs nourishment. It needs oxygen itself. So that part of circulation is called bronchial circulation. That is different from pulmonary circulation. Pulmonary circulation is what the pulmonary artery brings from the right ventricle and what the pulmonary vein drains into the left atrium. That all thing through the gas exchange areas, getting fresh oxygen, dumping the carbon dioxide, all of that blood is part of pulmonary circulation. However, the bronchial circulation is the blood supply to the tissue of the lung itself to nourish it, to keep it alive. Is this you have Yani, you have noted this? The difference between pulmonary and bronchial is a very key question. It's a very easy question, but it can be off throwing sometimes in a while. It does present a small problem. This is the problem. This is the problem. Because what's the difference between pulmonary vein and bronchial vein? Well, I've asked a question. Yes, pulmonary vein would carry oxygenated blood, wouldn't it? It would. You know this. And if you don't know this, go and revise from your FSC books. Bronchial veins, however, are typical veins. They carry deoxygenated blood because pulmonary bronchial circulation we have talked about. Now, the problem is, where do the bronchial veins dump their deoxygenated blood? Usually, venous blood is received where? In the right side of the heart. And then very nicely, it's guided to the lung for oxygenation. However, lungs' own blood, own perfusion blood, own blood that has given it nourishment and taken away the carbon dioxide, where would it go? It goes, because the architecture, the arrangement is such that it goes to the left side of the heart. Now, immediately you should frown. Okay, what's going on here? It is deoxygenated blood. Yes, it will mess up our nice, pure, oxygenated blood, which is coming in from the pulmonary veins, which we have taken so much effort to oxygenate, right? Yes, it does. It pollutes it a bit. So the oxygen levels of oxygenated blood are higher before they come arrive in the heart, because in the heart they get mixed with that little amount of deoxygenated bronchial blood. One, and if you really want to remember it in detail, heart's own blood, heart is also an organ, it needs nourishment. So the coronary vessels of the heart itself also have a venous division. So that venous division also gets dumped into the left side of the heart. So both of these small adulterations or pollutants, not pollutants, but adulterations, drop the oxygen concentration of your blood, which is arriving from the pulmonary circulation. And it does. And it gets dropped from 104, which is the nice, fresh, full oxygen, to 95. When you bring out fresh blood from the alveoli, the oxygen tension, the oxygen PO2, partial pressure of oxygen in that blood, in the pulmonary vein blood is 104, 104 mmHg. However, as soon as these two dilutions happen inside the heart, it drops to 95 mmHg. And this is fine. It's not a lot of drop. But this is an important point to note. Okay. Right. It looks busy, but it's a very simple thing. This is G-video. Bronchial artery arises from the aorta. That's a good question. Fresh blood. Good question. And you will obviously be doing a lot of this origins and terminations in anatomy when you study the anatomy of the heart and the lungs. So this is another peculiarity between. Forget about what's here. Just listen to me. This is another peculiarity, another difference between the pulmonary vasculature and the systemic vasculature. Whenever in a systemic artery, the pressure rises, you will do it in circulation. Whenever the pressure rises in a systemic vessel, it tends to contract. Lock that away. We will do it later on. Whenever there is pressure rising in a systemic vessel, it tends to contract and resist that pressure from going forwards. It's a protective mechanism. We call it vascular compliance. We will study this when we study circulation. However, the reverse, exact reverse happens in pulmonary vasculature. When you increase the pressure inside the pulmonary vasculature, it tends to dilate. It's literally another technology that is used in pulmonary vasculature. It doesn't contract, it contracts elsewhere. But the pulmonary vessels, whenever you, so for example, you have started to exercise. When you start to exercise, the right cardiac output would increase, wouldn't it? So at rest, it's 5 liters per minute. But when you exercise, it may go up to 10 or 15. If you really are pumping, it may go up to 25 liters per minute, right? How will the lung accommodate it? By dilating. Vessels are dilated like anything, and they accommodate that high pressure, keeping the same pressures inside the lung. Because look, if they don't dilate and you increase pressure, what can happen is there might be oozing of fluid outside the vessels, causing edema. Pulmonary edema is a medical emergency. People can die from pulmonary edema. Not peripheral edema, it's a nuisance, it's a problem, but edema inside the lung is fatal, can be fatal if it's not treated urgently. So normally it does not ever happen because of this property, the vessels of the lungs. They dilate, they relax as you increase pressure. Very important point to note. One other thing happens. So not all the vessels of the lung are open at all times. They don't need to. So let me put it this way. You have some regular clothes, right, which you tend to wear all the time. Then you have some backup clothes, which are reserved for some good occasions or whenever you feel more colorful than usual. That's backup stuff. Not exactly, but it's an example. The lung has been given lots of vessels, lots and lots of alveoli, more than what is required at rest, because whoever made the lung knew that your need might increase temporarily, but then very importantly would come back to rest. So those extra bits of vessels and alveoli, they are only opened when you need them. So as an exercise, and so on and so forth. But normally you are working with your regular clothes, the regular number of alveoli and the regular number of vessels that are supplying those open alveoli. So the entire lung is not open all the time in terms of alveoli and vessels. So one of the ways of describing what happens when you increase pressure is recruitment. So those closed vessels are opened by rising pressure. And even if that is not enough, then the distensions take place. So first, what happens is those vessels which are not usually used by the lung get opened up. That would then address the increased blood pressure that you have just introduced. Even if that doesn't solve the issue, then dilations take place in all of those vessels. Okay, and combined these two things, recruitment and distension, take care of the rising pressure. Okay, of course within physiological range. If the heart fails, the left heart fails, what do you think would happen? Not the right, the left. If the left heart is failing, it is the right side is working fine. So the right side is pumping blood inside the lung. The lung is working fine. The lung is dumping that blood into the left atrium. However, when the left atrium dumps its blood into the left ventricle is working at, say, 25% less than normal. There is a MI or myocardial infarction, heart attack. So the 100% working ventricle, left ventricle, is now down to 75%. What do you think would happen inside the lung? There will be pooling of blood because it's not going forwards. 25% of blood is staying in the heart, so back pressure starts to rise. That pressure eventually starts to rise in the lung. Now we have trouble. Edema will ensue and all sorts of issues. Normally it doesn't. It has a protective thing against pulmonary edema. Another peculiarity, and this is a very big one, is whenever there is hypoxia in systemic circulation. In systemic circulation, whenever there is hypoxia, there is vasodilation. So, if you were to really clench your wrist here like this and press it hard, okay, what will happen is there will be ischemia, less blood supply of your right hand. When there is less blood supply, there will be less oxygen that will go into it. Can we say that hypoxia has happened to the right hand due to this ischemia? Ischemia is less blood flow. Hypoxia is low tension of oxygen. Okay, so this clenching of the right wrist caused what was I saying? Hypoxia due to less blood flow. Now when I release it, when I release the physical thing, there will be rushing of blood inside the right hand because of vasodilation of the vessels. This is how the systemic circulation reacts to hypoxia. It vasodilates, tries to compensate for the lost oxygen. However, very interestingly, if you have a hypoxic situation inside the lung, the vessels in that area will go into vasoconstriction. You would think why? Why? There is already hypoxia. Why are we vasoconstricting those vessels? Well, the answer is pretty straightforward. Because why would you dilate them in the first place? The area is hypoxic. The area is not receiving proper air, proper oxygen from outside. It's hypoxic. So in lung, a hypoxic area is a useless area. Why would you want to give it blood? So you constrict it. You divert blood to the area which are more aerated, more normal air is coming to them. You load them and you divert blood away from this area which is now temporarily useless or maybe permanently useless. Okay, very important point to note that hypoxia has a absolutely opposite reaction to the blood vessels of the lung. A full alveolus and a half-filled alveolus has an effect on the alveolar vessels. So, if an alveolus is quite full, overfilled with air, it compresses the alveolar vessels here by virtue of its weight. However, this whole thing, it's literally when you put water inside a balloon, inflated with water, it goes down because it becomes heavy. Imagine that. I was thinking of how should I explain this to you. So if you overinflate an alveolus, it just bogs down, it goes down with it. The vessels which are underneath it will obviously be compressed, but what about the vessels which the alveolar vessel is hanging from? This will have a tug on it, it will have a pull on it, because the alveolus is sinking down. So this tugging effect will dilate them. This is a small point, okay? And the reverse is, when the alveolus is not properly filled, the alveolar flow will be much more than if you're interested, you can read this up. Why do we mention it? Now we are introducing the BQ. Now it starts, the main presentation. The reason we now are focusing on the alveolus and its vessel is because we want to understand what is the type of relationship that alveolus and the air inside alveolus has on the blood which is passing to the alveolar vessels, because this is the place literally where oxygenation takes place, gas exchange takes place. So oxygen comes out from the alveolus into the alveolar blood, and carbon dioxide goes into reverse. So whatever you have learned about the lung up till now actually takes place here. V and Q. Ventilation inside the alveolus. Q is blood flow in the alveolar vessels. These two are the parameters to actually think about, to understand. Then you will understand the function of lung.